So we continue with our talk about CBT for depression. We did one session about depression 2 weeks ago. We'll continue. And as I talked about last time, is I talk a little bit about the disease, then I talk about an activity or exercise, CBT exercise related to the disease. So you all know that depression is a debilitating condition, right? This is the most common cause of disability all over the world. About 12% of people struggle with depression. And I had a patient who was always telling me I would pick cancer over depression because he was trying like different antidepressant and nothing is working. Then he started trying magnetic stimulation, and anyway, it was very, disabling and causing problems at work, school, family. As we mentioned last time, is depression is a mood disorder, and the main symptoms is loss of interest and depressed mood. So you feel sad, and then you have no interest in doing things that was pleasurable in the past. Sometimes in clinic, we call it major depression or major depressive disorder or clinical depression. The prevalence almost different from one place to another, but we can say 10% of people would struggle with depression. Is it common in male or female? It's more common in female, 2 to 1. There is multiple hypotheses why this happened. Maybe because for women is easier to share their feeling and express how they feel, so they seek help more than men. That's why the statistics showing lots of women have depression, less men have depression. However, if you look at suicide, which is the worst complications that happen with depression, it is more common. Suicide is more common in men than women. But another hypothesis is women struggle with depression because of the hormonal changes that happen. That's why you feel there is depression for some women struggle with premenstrual syndrome, which is depression before the period. Some women struggle with depression in menopausal period, sometimes after delivery. Some scientists believe women struggle with depression more than men because they have more responsibilities, because they tend to be more responsible for the primary caregiver for kids, plus they need to work as well. And they are relationship oriented, and they have a stronger emotional attachment. So all these factors make them more vulnerable to depression. However, I'm saying like men commit suicide more than women. There is a hypothesis for this too, that men are more impulsive, more aggressive, so they take action faster than women. But anyway, it is the most common cause of disability all over the world. Sometimes we classify depression depending on certain symptoms. And why we classify it, because the treatment will be a little bit different. So for example, I'm sure you know about seasonal depression, which is at the same time each year you get depressed. And some people, I have some patients, they don't take antidepressant all the year, they take it only during 4 months of winter or 3 months during winter. Sometimes there is depression postpartum, which within 4 weeks postpartum. There is anxious depression, anxious distress, or mixed depression, when a depression comes with irritability. And the treatment for this depression is different from other depression when there is no irritability and no anxiety. So we see these patient with depression plus anxiety, they respond better to antipsychotic and mood stabilizers more than antidepressant, for example. There is a psychotic depression. You don't see this in an outpatient, but this one is more like in hospital. You see the severe depression start with hallucination and delusions. We call this psychotic depression. Chronic is when or persistent depressive disorder, when the depression lasts for more than a year. Catatonic, you don't see this. Also, you see this more in the clinic. Sorry, in the hospital. You can't treat catatonia in as an outpatient. Catatonia means a movement problem that happen with depression. Some people will be very inflexible or fixed position with depression. Some people will be purposeless movement, like uncontrollable movement. There's something called the echolalia, echopraxia, which is a patient who will manifest with symptoms in movement, but they repeat what you say, or they repeat the movement that you are doing, like imitate what you are doing. There is atypical and melancholic depression. Melancholic, this is a severe form of depression when you wake up depressed, and it's not easy to treat this one when you just open your eyes and you feel the sadness coming. Those people will have lack of sleep and lack of appetite along with the depressive symptom. Atypical is a depression when you gain weight with it and you sleep more. Maybe you sleep 18 hours a day and you eat a lot. We call this atypical depression. Anyway, this classification is not, this is just important for a healthcare worker or doctors who prescribe medication, because what your choice or how you choose treatment will be different depending on what type is the depression. Sometimes the depression is a secondary problem, not the primary problem. So sometimes other mental illnesses have some depressive symptoms. For example, adjustment disorder. This diagnosis means like there is a situational depression. You don't have a depression, but because you lost your son, or you lost your partner, or you lost your business, then you started to have or struggle with depressive symptom. We call this reactional depression or adjustment disorder. Bipolar depression is when you have periods of high mood and euphoria and excitement, and periods when you are very happy, and then few months you are very sad. When you have mood swings, like high and low swings like that, we call this bipolar. And that, again, the treatment is different from treating just depression. When there is a history of mania or hypomania, which is a period of happiness or excitement, the treatment will be different. Cyclothymia is a milder form of depression. Milder form of bipolar. So instead, bipolar is doing like very high and very low mood swings. Cyclothymia is a milder form. So still there is mood swings, but in mild form. Persistent depression is a chronic one, when it lasts for a year or two. Premenstrual dysphoric disorder is a depression, but it happened a depressive symptom, but it happened related to menstrual period. ADHD, you know, ADHD is attention problems. Sometimes it's associated with depressive symptom. So it's very important to know if this guy is depressed or this lady is depressed because she has no attention and she is failing at school and at work. That's why she is depressed, or she is failing at school because there is a depression. Is it depression secondary or primary? This is gonna change the treatment plan a little bit. This one, yeah, as I mentioned, you know, we don't have teens in our groups or children. So in children, the depression will come with more like crying, irritability, sensitivity, anger. A kid will not come say, I have depressed mood or I'm sad. It usually comes with irritability, anger. Sometimes it was in teenager, you find addiction secondary to depressive symptom. Also, school performance is an important symptom. Anyway, so we will, so this is depression. So every time we talk, we'll talk a little bit about the disease. Even next time, I'll talk about a little bit about the treatment for depression. But let's go back to the CBT. As I told you, one of the most effective ways of treating depression is counseling. And one of the most evidence-based technique is cognitive behavioral therapy, which you change your thoughts, gonna change your feeling. When you're feeling it change, gonna change your behavior. Last session, we talked about this one. We didn't care about thoughts and feeling. We just focus on behavior. I told you, you need to be doing something. That's why we tried to set a routine or a structure for the day. And I told you, anyone with depression, they need 3 behaviors to work on. They need some activities to induce pleasure, to bring happiness. You need some activities that gives meaning to life. So pleasure, meaning. And also you need mastery or achievement. You need to achieve something, because when you achieve something, this makes you happy. So this is without, looking into why you are depressed, what you feel, or what are the negative thoughts you have. You just change the behavior. We expect when we change the behavior, thoughts will be more positive, and then feeling will be more positive. But for today, we will focus on the opposite side of CBT, which explores the thoughts, explores the feeling, and they try to replace it with more positive. For today exercises, we just try to explore what are these thoughts and the feeling. That's just a summary for, when behaviors that are associated with depression is all negative behavior. You miss work, you use drugs, you isolate from people, you stay in bed. Usually the feeling of depression is depression, depressed mood, right? Fatigued, unmotivated, sad, unhappy. And they have lots of negative thoughts. There is no way out. I will always be depressed. I don't feel like doing anything. So they have lots of negative thoughts, and they don't see anything positive. They just discount the positive and focus on the negative. These are the common thoughts and feeling that we have with depression. Anyway, for today exercise, we're gonna focus on identifying 5 things. You need this, and this is the exercise for today. You need to tell me, when you are depressed, what is the feeling you struggle with? What are the thoughts behind this feeling? And then what is your unhealthy coping skill? And then what is the consequences of this unhealthy coping skill? And then what is the alternative? Again, this is one way of doing a CBT. I'm not gonna replace the negative thoughts with positive. This is next time. But today, just identify the feeling and try to find what are the thoughts behind it. And then what are the unhealthy coping skills that you use? And then what is the consequences for this unhealthy behavior? And then what would be the alternative positive coping skill? Anyway, this is the exercise you're gonna do today. I'm just starting with it, but I'm gonna go into details now. What is this exercise? So again, one of the part of the exercise, you tell me what is your feeling of depression. When you are depressed, what are the feeling? Okay, this is one exercise. Another exercise, when you tell me the feeling, tell me what is the thought behind it. Like this guy, I feel hopeless. This is the feeling, okay? Or I feel discouraged. And you ask them why, what are the thoughts? They feel like, or they think that I will never get into medical school. There is nothing to live for. These are the thoughts, and that cause these feelings. This is what I want you to do. Tell me, when you are depressed, if you struggle with depression now, or maybe in the past, when you were depressed, what were the thoughts that you had? I was discouraged because 1, 2, 3, 4. Okay. And then tell me what was the unhealthy autopilot coping skill that you use. Some people will stay in bed. This is what they do when they are depressed. Some people not answer phone calls. And then there is usually negative consequences for that. Uh, if you stay in bed all day, you're going to lose your work, or you're going to be expelled from college, or you're going to lose your friends because you are not answering the phone calls. So you tell me, so again, you're going to tell me a feeling, you tell me the thought behind the feeling, you tell me a coping skill that is unhealthy that you use, maybe drugs, maybe isolation, maybe spending lots of money. And then tell me what is the negative consequences for this unhealthy behavior. And the last part, tell me the next time you feel depressed, what are the alternative healthy skills that you're going to do. You don't have to put 10, few of them, like 3 or 4 would be enough. So again, what is the exercise today? Tell me when you feel depressed, what is the feeling? Tell me the thoughts behind it. Okay. And why we are doing this, we try to identify a pattern. Like some people will discount the positive all the time. Some people will think black and white. Some people will catastrophize. So this is a minor problem, but I see it as a major problem. So, but anyway, so the first step is to tell me what is the feeling, what is the thoughts behind it, and then you tell me how do you cope with depressive feeling, and what I'm sure you lost a lot of things because of the unhealthy coping skills, and then tell me what would be the alternative. Okay, I'll give you a few minutes to think about this exercise. Again, it is 5 things: feeling, thoughts, unhealthy coping skills, consequences, negative consequences for the unhealthy, and the last part is the alternative healthy coping skills. Maybe the alternative will be go for a walk, exercise, journal your feeling, talk to a friend, read a book, push yourself and force yourself to go to work even you feel depressed. Attend a course, join a group therapy, like whatever alternative that you can use. I'll give you a few minutes to think about this stuff, and then Brooklyn will run the discussion. Thank you.